This video is about the dietary advice to chronic kidney disease patients or CKD patients. First, the CKD patient will not take added salts. What is added salts? Added salts mean that the recommended salt is less than 2 gram per day because it will increase volume overload in CKD patients. The second point, CKD patients will avoid to eat bananas, juices, strawberry because it will increase the potassium level in CKD patient. CKD patients will not excrete the potassium from the body as their kidney nephrons are damaged. The third point, that CKD patient will not eat meat and pulses because these are proteinous products and creatinine are produced due to meat and pulses. Give protein according to dietary reference intake to CKD patients. The 4 points is give iron supplements, folic acid and vitamins because CKD patients can't produce enough erythropoietin. That's why, due to deficiency of erythropoietin, iron absorption from intestine is impaired. So, iron supplements are needed. The fifth point, CKD patients are advised not to take spinach, tomatoes, if the renal calculi is the etiology of CKD.